is Hi Salpity with ScreenMe. So I'll let you take it away. Thank you.
Good morning. My name is Hai Salpity. And this is a story about how I got here. The year was 2001. I'm sure many of you have had that embedded into your memory. For me, it was July 28th, the day my grandfather became a statistic in lung cancer death. Mere months after he got his diagnosis. He was healthy, he was happy, he wanted to travel. What follows is a series of what ifs. I'm sure some of us know. What if it was earlier? What if it was smaller? What if we had more time? And how do we get there? 10 years later, some really smart people figured that out. 30 seconds in a CT scan, which I'm sure some people in this room have had. 30 seconds. And you would be able to go from that big ball to that little ball. It could mean years. It could mean decades. Today, 1.9 million people is getting screened out of 14.6 million people. That's 12%. That number is dismal. That's 1 in 8 people with lung cancer is getting diagnosed early. Astronomically low. And why is that? The system is complex. We all know this. Is it available? Is it accessible? Can you get a CT scanner in the middle of the mountains in rural Tennessee? Can you get time off of work to sit down in a doctor's office, fight Cincinnati traffic for 15 minutes to find a parking spot, 20 minutes later end up in the office having the doctor run 45 minutes late, and then before you know it, the only thing you can hear is I'm late to get back to work? Is it affordable? What do you have to pay? In this day of age and inflation, do I pay for food or do I pay for a CT scan? And really the main reason is this. Is it fear? Do you really want to know? Most people, no news is good news. And to be honest, most people also don't want to sit in the doctor's office after 15 minutes in traffic and 20 minutes finding a parking spot to hear you should quit smoking, right? Nobody wants to be judged. Nobody wants to hear the word cancer. I'm too young. I have years left to live. So how do we fix that? Here's the answer. 4 simple questions at the palm of your hand or in front of the computer screen in the privacy of your home, without the traffic, without the gas prices, without the judgmental white coat looking at you, without the admission of, yes, I'm still smoking. What of it? Right? How old are you? What gender are you? How many cigarettes have you smoked a day? How many years did you smoke? Did you quit? Did you have a history of cancer? Did you have exposures? 4 simple questions, right? We have accumulated 60 years of knowledge into 4 simple questions you can answer on your own. Does it work? Let's look at this. 22% of apps are dedicated to healthcare, right? 22%, that's more than anything else. This little watch I have on my hand, people have it. They use it. They want to. They want to take their health in their hands without the gas prices, without the traffic, right? Think about a motivated employees using your healthcare apps to be able to find out what they are available. And then the companies have the data collection, the analysis, improve the programs, the accessibility, the affordability. In the days of cost sharing, the more people uses things, the cheaper it gets, right? And then you have incentives and rewards. You can build programs. And then it goes in circles and circles. Why here? Look at this map. The darker the blue, the higher the cancer incidence. Look at where we are. Indiana, Ohio, Kentucky, West Virginia, Tennessee, the Tobacco Belt, North Carolina. We have researchers all over this area willing, dying to jump on board, begging people, please get a CT scan. People just need to know how. At the end of those 4 questions, you get a phone number you can call. You can bypass all of us. And 78% of Americans are willing to do that, They've already answered the questions. They just need the technology. They need medicine to step out of the archaic ages and enter in the technology age. It addresses the availability, the accessibility, the accommodation, the affordability, but most of all, it addresses the fact that you can face your fears in the comfort of your own living room, in the company of people that knows you, that cares about you, instead of shamefully sitting there listening to you should quit smoking, and inside your head said, I have cancer, and that's all you hear. You hear nothing else. Who benefits? Governments, health insurance, electronic health records. All of these entities are dying to just do something to help these people because financially, it all makes sense. So what are we asking for? We're asking for a team to take this prototype and elevate it further and integrate it into the market in whatever form that can reach these people that we're trying to help. The investment it takes to build these things and the opportunity to sit down with all of those payers and say, hey, we have a solution for you. Come join us. Be part of the team that gives more years. Happy to take any questions.